So, of course, that's the bad news. You have a tension type headache. Here's the good news. How can we at Rothrock Chiropractic and Rehabilitation address it? Well, much like any condition we address in here, we like to take a three-prong approach. We're going to address with rehab, we're going to do plenty of muscle work, and we're going to use our chiropractic manipulation therapies to address things. First, with the rehab, if it's a true classic tension headache that starts to wrap along this way, like we addressed that dull, achy, throbbing type symptoms, then there's usually going to be a McKenzie exercise that works really well. Typically, it's a held retraction to reset that joint and melt down the trigger points that live in the suboccipital muscles. And if we find that that's the directional preference, patients can really control a lot of their tension headaches just by addressing that exercise and implementing that exercise alone. In time, it's really important to go back and strengthen things to actually stabilize somebody through the shoulders so that way it's easier for them to hold that good posture, to get the deep neck flexors stronger, and to take that tension away from that upper cervical block right there. Next, the muscle therapy. These are the things that we do in office. So we really like to do pin and stretch on those suboccipital muscles. Typically, patient will be on their back and we cup those muscles and we work on helping that patient get more rotation at the neck and the skull while we really reset the input on those suboccipital and upper cervical extensor muscles. Elongate is also really nice as well too. Just long stretches and long sweeps up the length of the neck to just get tons of rich blood flow into there, reset the pain response on the muscle fibers and on the nerves to start improving that pain response. And last, being chiropractors, we love to do chiropractic manipulation therapy. However, the neck is an area that we have to slow down and be really cautious with. We do know that if we move with reckless abandonment, we could possibly compromise the vertebral or the carotid arteries. So, not everyone is a good candidate to have a neck adjustment. So, if somebody's a good candidate for a cervical manipulation, then of course we'll do those. We like to also work into the upper thoracic spine because just by addressing the function at the upper thoracic, we can gain 5 to 10% improvement of functionality in the neck just by addressing that region alone with nothing else. So it makes sense to just tackle it all as a holistic bunch. If we find or determine that we don't want to manipulate, whether that's the patient's concern, our concern, red flags from their previous medical history or family history, whatever have you, then a really good technique to use instead to address the neck for tension headaches is actually the McKenzie traction plus retraction technique, where we essentially stand at the head of the table, make a contact on the chin and the back of the head, create a lot of long traction, and then really maximally open up that space by inducing a retraction at the end of that traction movement. We actually have that video already on this channel. It's in the linked below. So if you want to watch it, feel free to click on that, please.